Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today my special guest is Dr. Niki Davis. Dr. Davis is a medical physician, board certified in both lifestyle medicine and family medicine, and a member of the medical telehealth, Love.Life telehealth service. And welcome, Dr. Davis. It's great to see you and meet you. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education. That's great.
It is very nice to meet you. I've heard all about you, but just we've never met.
Okay, you're right out of the blocks. I got to start right off with the fact that, before you did medicine, you had this connection to advanced graduate program in mechanical engineering, and on your site it says you made a contribution to the space shuttle program. So that leaves me the opening. What was the contribution? I'm absolutely intrigued by that background. It's amazing.
Yeah, great question. So I live in Salt Lake City, Utah, and just north of here is a rocket company, and they used to work on the space shuttle program. So there were two if you look at the old space shuttle that had the big orange rocket in the middle, the two white rockets on the sides, we worked on those two white rockets on the sides. So I got to work on that program and be a part of the launches, and making sure that everything looked okay on launch day, and also involved with all the testing. So it was actually a pretty fascinating job.
Absolutely. Well, it absolutely sounds exciting. But your love became really dealing with healthcare and medicine, obviously, because you moved from that. But when I look back at your history, I found it intriguing because it said you got turned on to kind of eating more plant-based in your early teenage years, related to even some health considerations. So the thing that came to my mind is, how did you have the presence of mind at that age of your life to, for number one, make that change? And to number two, make a connection that somehow it would improve health outcome. So talk a little bit about your past, about the kind of the segue from that into, your education and your movement into medicine.
Yeah, so I went vegetarian as a teenager, I think for a few different reasons. Well, I'd always been an animal lover, but honestly, when I made that decision, I just felt that whenever I ate meat, I just didn't feel great. I didn't feel my best. And it was also around that time when I was about 13, 14 that I started noticing weight and what did I look like and how did I feel? And so I just felt that giving up meat would be beneficial for my health. And even though I didn't really know anyone else who was doing it, it just was something that I thought I wanted to try to see if I felt better. And it turns out that I did, and I loved it. And it put me more in line with what I felt in me from the beginning, which was that, why am I eating animals? I love animals. Why am I eating them? And so that's what kind of started this whole process of changing my diet over time. But then it wasn't until I was working as an engineer that I really thought to myself, okay, I'm not getting any younger, and I want to do something with my life that has meaning and purpose, that I can feel proud of and get excited about. And unfortunately, engineering wasn't that.
Right.
So it made me have to have this shift in my thinking of, well, what is it that I want to do with my life, and how do I want to try to make an impact using something that I'm really passionate about, which is health and plant-based nutrition.
Well, starting as early as you did, was there, any kind of backlash in your family? I'm assuming your family didn't eat that way. And now you as a teenager is taking this stand, and you're still living at home. So what kind of pressure was that growing up, having to deal with, and I don't know how your family ate and lived, so maybe you can share that a little bit, but was there any pressure, that you were feeling to not do that? And how did you kind of transcend that at that early age? I mean, 'cause that's an early age.
Right. It was. And my family was definitely not vegetarian at all. And they thought that I was doing something probably unhealthy, that it wasn't smart for me to be doing it. But my mom, all she said to me was that even though she didn't really agree with it, that she went out of her way to accommodate me and try to make sure that I had things that I could eat. And so I never felt, besides just the occasional comments that my dad would make, you need more meat, why don't you just have a little bit of chicken? Ultimately, I was not dissuaded at all by that. I was really, I felt that this was the right thing to do. And I knew it when I started doing it, that it was just, this is who I always was, and just never realized I never was given this choice. I was always just fed meat from the beginning. So once I actually started doing it, I thought, this is how I want to live. This helps me feel better. And I really like eating this way.
So a segue, moving forward, as you move forward, doing what you do now, has your family embraced any more of that over the years? I mean, how have they moved in their own lives in relationship to this way of living?
Yeah, in fact, I would say, in my immediate family, most of us are at least vegetarian, if not all nearly vegan. I could never get my dad to do it. And sadly, he passed away, but he was 92 when he passed, so he had a long life. But as far as my immediate family goes, I was the only one for some time, and I was the one that was bringing my own thing for Thanksgiving, and we still had a turkey on the table. It's not that way anymore. I think that over the years, because it's been so long, that my family has adopted much closer to my lifestyle and my diet than they did in the past when I was younger.
I have a curiosity because in looking at your history, I noticed that you did a very rigorous residency in family medicine. And family medicine always, in my mind, strikes me as like the old general practitioners that were involved in all aspects of family health and personal health of families. And we know that one of the problems with a lot of medical education is that many docs wind up just becoming disease managers. There's no sense that things can be prevented, and certainly not reversed. Some of the major things that we know can be reversed, like hypertension, diabetes, things of that nature. So in that training, just for my curiosity, because it's a little bit more of an expansive way of treating families and people, did they bring in any lifestyle stuff into that kind of a residency? Is there, when you do a family medicine, is there something a little bit more past just the managing of disease, or is it pretty much still stuck in that mode?
Well, I would say that because the reason that I went into medicine was specifically so that I could have the job that I have now, which is being a lifestyle medicine doctor, helping people treat and reverse chronic disease, right? And so family medicine, I felt most matched kind of what my goals were, because family medicine does take into account prevention. They do talk about lifestyle measures. However, it kind of stops short, because what ends up happening is you go to your family doctor, and although they know that they need to bring that up, so let's say you go in and you get diagnosed with diabetes, they know that they should say to you, hey, let's try lifestyle first. Let's have you exercise, let's have you improve your diet, and then we'll see how that goes. And then maybe if things don't go well, then we'll start you on a medication. Unfortunately, that's not always what happens, because first of all, we're very quick to just prescribe medications. If you're diagnosed with diabetes, you get metformin day one. If your A1C is really high, you might just get started on insulin immediately. You don't really get a chance at lifestyle measures. And even if you did get that chance, you got a good doctor who said, hey, let's try this. Unfortunately, because we don't get that training in medical school, we just don't even know what to tell you. All we know to say is, well, you should eat a healthy diet and exercise. But to actually be able to tell someone what that looks like and how to go about doing it in a 15-minute visit, that already you're probably left with 2 minutes at the end, maybe, if you have that, it's nearly impossible. So even though family medicine did line up with, I think as closely as it could with what I wanted to do eventually with lifestyle medicine, it was still lacking. And that's why lifestyle medicine exists, right? Because that wasn't available.
Yeah, we're going to get into that
Um,
discussion for sure. We're going to take just a very short break. I'm here with Dr. Niki Davis on the Health Science Podcast. We're going to take just a short break to hear from our sponsor, the National Health Association, and we'll be right back. You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here. Are you ready for an extraordinary adventure that combines relaxation, exploration, and vibrant health? Then set your sails for the NHA plant-exclusive cruises. Imagine cruising through exotic destinations, savoring delectable plant-based cuisine, and engaging in rejuvenating activities, all while surrounded by like-minded individuals passionate about health and wellness. These cruises offer more than just a vacation. They offer an opportunity to immerse yourself in the NHA's principles of healthy living. And they rank incredibly high on the ratings of eco-friendly cruise lines. We all know how important our oceans are, and our cruise partner Windstar is fully committed to this. Join us aboard our upcoming plant-exclusive cruises and experience the synergy of health and leisure. Delight in gourmet SOS-free meals prepared by talented chefs. Attend informative workshops and enjoy the serenity of the sea, all tailored to nourish your body, mind, and spirit. For more details and to reserve your spot on our next adventure, visit healthscience.org and click the link under travel. Don't miss this chance to indulge in a wellness retreat like no other. Elevate your well-being and make memories that will last a lifetime. And remember, your feedback matters. Please take a moment to leave a rating and a review wherever you're listening to the NHA Health Science Podcast. I'm Dr. Frank Sabatino, your host. Now, back to the show. Welcome back to the Health Science Podcast. I'm here with my special guest today, Dr. Niki Davis. And, I want to ask you this question because you had that training. So now give me the aha moments that lead from that and segue into your connection with lifestyle medicine and then your board certification and the people along the way that provided some of those aha moments for you. Let's talk a little bit about that dance and that history.
Yeah, well, and first of all, my training was a little bit different than I think most lifestyle medicine physicians, where I would say most everyone that I've talked to, they go into training and they work as a family doctor, internal medicine doctor, a specialist, and they very quickly see that patients tend to not get better over time, that they tend to get worse, and that we are just managing disease. And that's not really a fun job as a doctor, to not
Right.
see people get well. And so then people kind of look back and say, okay, why did I get into medicine to begin with? Because I wanted to help people and I wanted to help people get well. And then they get turned on to lifestyle medicine and then go back and then have that then become part of their practice. Whereas for me, it was different. I was already pretty much on board with lifestyle medicine and especially plant-based nutrition before starting medical school. So I knew that that was what I wanted to do throughout training. And so then my mindset was a little bit different than most, where even though I was getting this traditional training, in the back of my mind, I knew that eventually my job was going to be helping people get well. And so I started seeking out those opportunities early on to get training in, which I don't think I knew at the time that lifestyle medicine existed, but that's what I was looking for. So I applied for rotations and internships in places where I felt that I could get that experience that I wouldn't get in either medical school or residency training.
Yeah, and I noticed you went on and you got, some nutrition certification from the Colin Campbell Center for Nutritional Studies at eCornell. I know you also got some certification, obviously, through John McDougall with the Starch Solution. So obviously that was part of your dance through the lifestyle medicine path. You were gathering this other information and knowledge along the way. And I noticed you talked about a number of mentors that are, of course, people have been doing this a long time. There are many of them very good, close personal friends of mine through many, many years now. So I know you got education connected to Dr. Clapper and Dr. Goldhammer and Dr. McDougall. And so obviously you were attending programs and things that they were sharing obviously with docs or lifestyle medicine docs. And so I guess that bolstered. But I noticed even early on in your residency, you kind of took a little bit forefront because you had that little bit of an advocacy group, that Plant-Based Montana, where you were doing your residency. So I know you were already setting it out in the world even back then. So have you taken anything from that advocacy work into what you currently do? Whatever you learned from that, or whatever the instrumental things that came out of that, have you carried that forward in any way?
Right. So, yeah, when I was in residency, I was looking for not only training opportunities, but how can I start doing what I want to do now? Even though I was, in a very difficult residency program away from home a lot, I still felt this desire to get things going with the lifestyle medicine stuff. So that's why I became wellness chief for my residency, where it's basically just looking at the wellness of the residents and how can we help them do better by making sure that they're taking good care of themselves. But then in addition to that, starting Plant-Based Montana, which was an advocacy group that was just basically trying to spread the message of plant-based nutrition to our community and hopefully to other providers, because if the providers understand the benefit of a plant-based diet, then they might spread that to their patients. So I think that what it taught me was not only the benefit of bringing people together and helping, once you bring people together and teach people and show them, like we would have not only a cooking demonstration, but we actually had people come in from the community and we would cook with them. Mm-hmm. So actually right on the spot, okay, how do you cut an onion? How do you cook without oil? What does your meal look like? And then is it delicious? And then we get to try it at the end.
Right.
So really getting to get down to one-on-one, with people and just bringing people together, feeling like you're not alone and feeling like this is possible. I think that's really what that showed me, was doing those kinds of events when I lived in Montana. So that was excellent. And then of course, it also allowed me to start doing more speaking opportunities, learning how to speak in front of people and getting the message across. And so that kind of started that for me as well, so that I could go out and spread the message more effectively.
So let's move more into present time now. So now I want to get an idea from you, how working with the telehealth service that you're with, right? Love.Life Telehealth, how does that become the best platform for your passion in doing the kind of work that you do? Let's talk a little bit about what it means for you to be on that service and how you approach patient care on that and how that fulfills you in terms of your passion for lifestyle medicine.
So many ways. So for instance, being able to bring this kind of care to anyone in the world is first of all, because it's not just me as the doctor at Love.Life Telehealth. There are, I think, 11 of us now, and we cover all 50 states in DC and internationally. So no matter where you live, you have access to a lifestyle medicine doctor. So that's really key. And then the other part of it is making it to where people have time to sit down and talk with you. Because when I was in residency working as a family doctor, I saw very clearly how little time I had with each patient and how I was trying myself, even though I was very motivated to squeeze in that lifestyle medicine component, I found it very difficult to do because of everything else that we were expected to do in those appointments. Mm-hmm. So having these 30 and 60-minute appointments where that patient gets all of that time just for them, they're not waiting in a waiting room, they're not having a nurse come in and checking things. They're not having to take off work necessarily. And I have people call me when they're in their car. We have evening appointments or weekend appointments, but you actually get that full amount of time with your doctor. So I think that that's a really benefit. And then of course, for my benefit, I get to see people getting better. And that is, as a physician, I think that is just gold. I mean, so many doctors get burned out because of just the day in, day out of the same thing every single day, and people
they don't see better. They don't see people getting well, and it's really
they don't.
It's frustrating as hell. There's no question about it.
It's frustrating. and they don't think it's possible. And when it does happen, if I have a patient of mine that gets better and then they go back and they see their primary doctor or their specialist, and that doctor says, well, now hold on, how can this even be possible? Like, what have you done? Okay, there's got to be something else that you're doing. They just can't believe it because it's not what they get to see. Where I get to see it every single day, and I see how possible it is. One of the things, Frank, that I noticed when I was in residency, I had one of my supervising physicians was quizzing me, and she said, "Is diabetes reversible?" And I knew that it was,
Right.
but I knew what she was trying to get me to say. She was trying to get me to say that no, it's not reversible, but it is manageable.
Mm-hmm.
With the right treatment, you can manage it, but it's never going to be reversible. And I have to say, with the experience that I've had and seen the reversal cases over and over and over again, it is absolutely reversible.
Right.
There's no reason that you have to live with this chronic lifestyle related disease if you get rid of the lifestyle component that is causing you to have the disease to begin with.
Yeah. I'm here with Dr. Niki Davis. Niki, let people know where they can find you. What's the address, the URL that they can go to learn more about you or make appointments with you?
Sure. My website is drnikidavis.com. And I also work with Love.Life Telehealth. So they are at love.life/telehealth. And so you can find not only me on there, but you can also find all of the other lifestyle medicine doctors that I work with so that we can bring lifestyle medicine to everyone in the world.
Niki, now I'm assuming that you do the telehealth service and you probably have your own private practice for people face-to-face, wherever you're located. You're in Utah. I think you're in Utah, right? Still? Yeah.
Right. I'm in Salt Lake City, Utah. Yep.
So compare for me, if you will, because this is something that always comes up in practice for all docs, the issue of compliance. Now, I know when people make an appointment with you on telehealth, it's almost kind of like they're a little bit part of the choir because they wouldn't make the appointment if they weren't open to some of the lifestyle modifications you may want to share. So maybe that makes it a little bit easier. But how does that compare, the issues of patient compliance of what you recommend compared to what happens online to what happens face-to-face in your office?
So you're right. Definitely most of the patients who come to me are very motivated and they want to make change, and that's why they're reaching out to me. But I do have some patients that will reach out to me, and the first time I visit them, they say, well, my wife made this appointment for me. She wants me to change. Or my neighbor is doing really well and they said I should contact you. So there are some people that still need a little bit of convincing, but for the most part, they're pretty motivated.
Yeah. Is there any conflict? Because I'm assuming with the people online also have primary care physicians that don't have necessarily your orientation. So they may be seeing those folks as well as coming to you. And is there a conflict that can come in that where those docs may not be on board with the kinds of recommendations you're making because they don't necessarily believe it's going to work? So do these people deal with any conflict that sometimes it's difficult to resolve in the care you're offering online? I'm just very curious about that.
Yeah, well, we still recommend that people have a primary doctor that they can go to because as lifestyle medicine doctors, in a way, we are more of a specialty doctor. We don't do everything that a primary doctor would do because we can't see you in person.
Right.
And so when you have things come up acutely that you need to be seen for, you want to have a relationship with someone that you can see in person because I can't listen to your lungs. I can't prescribe antibiotics for a skin infection or something like that. So I do think that it's important to have that. Now, the difference that I've seen in support for, that physicians have for their patients, it's the gamut, right? I sometimes will have patients where they say, oh, my doctor told me to look into this and they actually forwarded me a website, that was how I found you. And then the other side of it where my doctor is absolutely not supportive at all. In fact, I might end up getting a different doctor. But where I am is I say, I'm willing to work with whatever we have. So
Right.
if I need to get on the phone with your doctor, I'm happy to do that. If we need to coordinate care together, we can do that. If your doctor wants to talk to me about how to help their patients get better, I'm happy to do that. So think of it more of a collaboration.
Well,
We can do that.
Yeah, the proof is in the pudding anyway. So for example, if they come in with, let's say, high blood sugar or hypertension, high blood pressure, and your recommendations are changing that and bringing that down, the home care doc has no choice but to address the fact this has improved, so I'm going to have to back off on certain medication. So it's almost imperative that the results that the patient or the person is experiencing are going to kind of dictate the kind of care that actually results even from their primary doc. So I could
Right.
see where that could lead to, a positive outcome that way with less conflict, because the body will be the final deciding factor of that patient, so.
Yeah, and that does happen a lot where I will treat someone, their numbers will improve, they go back to their regular doctor, and their doctor says, "Oh wow, what did you do? How did you get things better?" Right? And it's a benefit for everyone. And so sometimes it just means that instead of seeing their doctor in 3 months like they normally do, they might work with me for a little while, take a break from seeing that
Right.
primary doctor. And then once things are better and improved and their A1C is better, their blood pressure is normal without meds, then they go back and see their doctor and say, "Hey, I made those lifestyle changes that we talked about, and now I'm off my meds," things like that.
Nikki, in relationship to some of the other pillars of lifestyle medicine, whether it's activity, physical exercise, or stress management, I don't know what your total skill set is, but do you address those issues like with stress management and different things of that nature? But I guess you have the ability to collaborate with other people in the service. If you didn't have something like that you could do, you could certainly bring it in a collaborative way. But so do you address those issues with your people too?
I do. Yep. Any of the pillars of lifestyle medicine that come up, we have information for, we have resources, we have coaches that we work with. So there are all sorts of different things that we can do to address all those things. I will say that most people come to me because they're interested in the plant-based diet part, the pillar of lifestyle medicine. But we do talk a lot about stress and relationships and social isolation.
Okay.
You know, sleep, especially. A lot of people are struggling to get enough sleep. So all of those things I think do tend to come up. And part of our questionnaire that we have people fill out asks them about all of those pillars so that I know what is going on with this person before I meet them.
So how does Dr. Davis take care of her own lifestyle medicine? What are the things that turn you on? Are you very physically active? Do you do certain sports? Do you talk a little bit about how you take care of you? Because we got to do that physician heal thyself just a little bit, many times, that.
I totally agree. I do love being active. My favorite thing is to walk. So I have a little dog and I take her down to the park and walk her around the park. That's kind of my way of getting out and getting sunshine, getting into nature, and then getting some physical activity. And just recently I was able to do a forest bathing walk at one of our local gardens here in Salt Lake City. And that was fantastic.
Yeah, that's
And that
beautiful.
was kind of like
Fantastic.
mindfulness and
Yes.
connecting. The other thing that I like to do as far as just staying socially connected and building relationships is I do a monthly potluck in Salt Lake City. I just started that in January, but it's been very successful. And it's been a really good way to not only eat good food, but also just meet other people in the community and to have that connection. So that's also
Where do you
helping
do
me.
that? At your office or your home, or where does that done?
Yeah, so it's in a conference room that's in my office building.
Okay,
Yep.
cool.
So we do it every single month, and it's been wonderful. So
Well,
those are the kinds of things that I like to do.
yeah, that community sense, that connection is so very valuable and so important for health and well-being. So in terms of, I know you do a lot of speaking engagements and those kinds of things. So what are your plans? What do you see next for you? I mean, I know you're very comfortable with the service. You're doing speaking. Is there something you're working toward or working on, or something you're looking toward as a goal in the future for you?
Yeah. So because most of my work is just like what we're doing now over video and not actually, face to face in person, I really crave that. I like to be around people. And so what I would like to do in addition to doing my virtual lifestyle medicine practice is doing more in-person events. And so not only doing the potlucks that I've already started, but doing more retreats and maybe medically supervised programs. So I'm doing my first retreat in a couple of weeks. I'll be in Belize with other women who are looking to lose weight and kind of reset and learn how to cook plant-based at their home. So that'll be the first one that I get to do. And then after that, I'm hoping to do more of those where we bring people together and really show them how to live this
So,
way.
Niki, did you find a nice little property in Central America? How did you find the place in Belize? What are you doing? Where is it?
There's actually a woman who started this retreat center. She's vegan and she has been for decades. She and her husband built this place in Belize just within the last 2 years. And so I've been talking to her and I said, hey, is this something that we could do at your retreat center? She said, absolutely. So we just decided to go for it. And it was very popular. We were able to get it booked and yeah, I'm really looking forward to going.
That's fantastic because sometimes, my experience through the years, sometimes people get a little wary about leaving the mainland. So it's nice that you found people comfortable and willing to go to this beautiful place. I'm sure it's going to be lovely, and that's fantastic. And is that going to be listed on your site or any of that, any of the URLs that you gave us? Will that be listed there about your retreats?
Yeah. So
Okay.
on drnikidavis.com, there's a specific section called retreats.
Okay,
and so
great.
right now, the only one you'll see there is the Belize retreat that's sold out. But as soon as new ones come available, I'm hoping the next one will actually be in the States in Southern Utah.
Okay.
So I think that one will be coming soon.
Utah, you've got a beautiful natural setting, so there's a lot of beauty there too that you could really use for retreat. That's fantastic. Niki, as we wind this down, do you have any final words you'd like to share with the audience out here?
Well, I would just say that, one of the things that I have seen patients get really frustrated with is this thought that they are going to have to be on medications for life, that their chronic disease is going to be with them for life. And that's a really hard pill to swallow because it's not necessarily true. I mean, certainly there are going to be places in which it's difficult to reverse certain conditions, but I really like to tell people that, the power is within you to be able to improve your health. And it really is a wonderful life. And I personally don't feel restricted at all with how I eat and how I live. In fact, I love it. And I'm just so glad that I found it when I did. But I'm here to help navigate that with people. And I love being on that journey, even though I'm not the one that has to do the hard work, which is make that huge lifestyle change. I get to just be a part of it. And I really welcome that. So
it's a beautiful thing. It really is to see that empowerment and that outcome. I understand that. I can't thank my guest today enough, Dr. Niki Davis. I urge you to follow Dr. Davis. Her location is in the show notes. You can see it going across. She's with Love.Life Telehealth. You can make appointments to see her through that. On her site, you can also follow up on future retreats that she'll be involved in that may be of great interest to you. So follow her as you can. And I really want to thank the people that joined us tonight. Without you, we can't do what we do. And I want to really thank you for being part of this very active, healthy community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I look forward to being with you on the next episode of the Health Science Podcast. Thank you so much. Thank you, Niki, really.
Thank you.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.